Hello, and welcome to Focus Med's Facts with Dr. Krissy. I'm Dr. Krissy Gleaton, your host and your pharmacist that cares and empowers. Welcome to Focus Med's Facts with Dr. Krissy, where we address the healthcare concerns of our patients and community. I want to personally thank you for tuning in and encourage you to send your questions to info@focusmedspharmacy.com. Your question may be featured on our podcast, to share with others, or may be directly answered via email, but I guarantee you that it will be answered. Our healthcare hot topic question of the day is, what exactly is shingles, and do I really need to get the vaccine? I'm excited to answer this question and give you the facts so that you can, as always, make an informed healthcare decision. So let's start at the beginning. What is shingles? Shingles is a very painful rash caused by a viral infection. The virus that causes shingles is the same virus that causes chickenpox. If you were born in 1980 or prior, like myself, you most likely had the chickenpox and can remember being covered in a thick pink lotion that made you think you were turning into the Pink Panther. After about 5 to 10 days of being told not to scratch, the rash probably began to go away and you felt much better. But did you know that the rash really didn't go away? Once you were exposed to the chickenpox virus, known as varicella zoster, the virus is always present in your body for the remainder of your life. The virus lies dormant or rests in your body until it's given the opportunity to represent itself as shingles. Shingles usually presents itself in a rash, like the chickenpox, but is painful rather than itchy. It's often sensitive to the touch, depending on its location. Some people experience shingles pain without ever developing a rash, causing it to be mistaken for problems with the heart, lungs, or kidneys. Although the shingles may present itself virtually anywhere on your body, including your eyes or mouth, it's most commonly seen as a rash that wraps around either side of your torso. While the virus is not deadly, it may lead to permanent nerve damage, eye damage, and lifelong pain. So what causes this virus to reactivate itself? Well, the reason is unclear. However, it's thought that it may be due to a decrease in the body's defense mechanisms as we age. Shingles tends to be more common in adults age 50 and older and those with a weakened immune system. Anyone who has had chickenpox may develop the shingles. Even if you don't remember having chickenpox, studies show that 90% of persons born before 1980 have had exposure to the virus. Thanks to the availability of routine childhood vaccination, most children now are protected against the chickenpox. So why should you protect yourself against shingles? Well, for one, the complications may be severe. For some people, the pain of shingles persists long after the blisters disappear. This condition is called postherpetic neuralgia. The pain from postherpetic neuralgia can be lifelong. Shingles may also cause inflammation of the brain that results in problems with hearing or balance. It can also cause eye infections that result in vision loss. Be mindful that shingles may be contagious to anyone who isn't immune to chickenpox, especially newborn babies. As a healthcare professional that has seen firsthand the results of shingles, I highly recommend prevention of this virus. Currently, there's one vaccine available in the United States to prevent shingles, known as Shingrix. Shingrix is a recombinant vaccine made up of inactivated parts of the shingles virus that help your body to recognize and fight against the virus. It is given as a 2-dose series, meaning you will need 2 shots separated by 2 to 6 months. The vaccine does not contain mercury and has been shown to be over 90% effective in preventing shingles infections. The CDC recommends that all persons age 50 and older and those with a weakened immune system receive the vaccine. Persons living with diseases such as HIV/AIDS, cancer, and those on drugs that suppress the immune system, like chemotherapy, transplant rejection meds, and steroids, should highly consider vaccination. Persons that are allergic to any component of the vaccine should avoid it. Although the vaccine isn't a cure, it will definitely reduce the course and the severity of the disease and lower your risk of long-term complications. Studies show that the vaccine offers protection for more than 5 years. You should note that the vaccine is not intended to treat persons that currently have the disease. If you or someone you know suspects that you may have shingles, consult with your pharmacist or other healthcare provider. If you test positive for shingles, medications such as antivirals and pain medications may be prescribed. Shingles may last between 2 to 6 weeks, and it is possible to get it 2 or more times. Getting vaccinated lowers the risk of reoccurrence and the risk of severe complications. If you are in the Charleston, South Carolina area, Focus Med's Pharmacy provides walk-in shingles vaccines daily from 9 a.m. to 6 p.m. The vaccine is free to most qualified persons with prescription insurance coverage. Stop in today to protect yourself and your family. If you currently suspect that you have the shingles and do not have a healthcare provider, our pharmacy offers in-house telehealth appointments with a provider that can get you the help that you need. Contact us at 843-818-4638 for more information. This has been another great episode of Focus Med's Facts with Dr. Krissy. As always, be empowered, enlightened, and emboldened about your health. Until next time.